I'm Dr. Thompson, Akwo, Ntuba, international political leader, physician, and communicator. Certified professional and expert in global health, USA. The 75th World Health Assembly has just begun. And this year's assembly is very, very important because there is the nomination and election of a new Director General. But so far, the Executive Board of the World Health Assembly, that is composed of 34 members from the 194 member states, has presented a single candidate unopposed in the person of Dr. Ghebreyesus Tedros, the outgoing Director General of the World Health Organization, who has been the head or the chief executive or director of the UN agency for the past 5 years, working on the triple billion vision. During these past 5 years, we've worked with Dr. Tedros, who took over from a colleague, Dr. Chan from Asia, or Margaret Chan from Asia. And in the first 3 years, Dr. Tedros was working on universal healthcare, which is founded on primary healthcare, health systems, and strengthening health systems in the different member states. Talking about the pillars of the health systems: the financial, looking about an increased number of those who are actually insured in the different countries, especially advanced nations like the USA, where there is disparity as it relates to healthcare insurance. The affordable healthcare, or the Barack Obama or Obamacare notwithstanding. The health infrastructure, the health information system, service delivery, human resources and healthcare. Because in the different specialized health care sectors, like our nurses, they've been talking about shortages or staff shortages and better environmental conditions of work for the nurses. Healthcare personnel or human resources being mobilized and more being trained. President Macron addressed the opening and talked about the WHO Academy in France. The Kenyan president talked about the contributions of Kenya and Africa and other continents in the COVID work. Botswana, its president, also addressed the meeting. The Prime Minister of Indonesia and other leaders from the Americas. The 17-member General Committee, a Committee A and B, and others are already in place. The president of the WHA comes from the Eastern Mediterranean region and is already in place. So all is going according to plan. And the delegates are already working to take the decisions to do what their member states have sent them to do. It's incumbent on the representative to be objective. The geopolitics of the day can affect the outcomes. So member states have been called upon to continue to support the work of the World Health Organization as the leading global health agency of the United Nations.